Did you know there's a Parkinson's medication that metabolizes into meth? Kinda. This is medications that metabolize into other medications, part 3. The Parkinson's medication, selegiline, gets metabolized into levomethamphetamine as well as levoamphetamine. Selegiline is in the drug class of monoamine oxidase inhibitors, specifically for MAO-B. It's a selective MAO-B inhibitor, however, it can lose selectivity at higher doses. I don't know if y'all have ever heard of this, but monoamine oxidase inhibitors are also a drug class that we use for depression. It's an older drug, has a lot of side effects. Phenelzine is an example of a non-selective MAO inhibitor. Monoamine oxidase is an enzyme that actually degrades dopamine. Remember, Parkinson's is a neurodegenerative disease characterized by a loss in dopamine-producing neurons. Monoamine oxidase also plays a role in the catabolism of serotonin, norepinephrine, epinephrine, and some other things. It does what it does in the name. It oxidizes monoamine oxidase. So selegiline blocks this catabolism of dopamine via this pathway. There are also some other drugs that block this enzyme, COMT or catechol-O-methyltransferase, but MAO-B inhibitors like selegiline can be used for initial monotherapy in early disease or as adjunctive therapy in later stages of Parkinson's. I will also mention that Sinemet or carbidopa-levodopa is generally considered gold standard therapy for Parkinson's disease. So, levomethamphetamine. Levomethamphetamine is also in Vicks Vapo Inhaler. It's a selective norepinephrine releasing agent. OG methamphetamine is a racemic mix of levo and dextro. Dextromethamphetamine is where we get its dopamine releasing activity as well as addictive potential. You see pretty much the same thing with levoamphetamine. Here's an affinity chart. Here's levomethamphetamine. A higher number means less of an effect. And up here is levoamphetamine. Dextroamphetamine has a more pronounced effect at increasing dopamine release. I'll also mention that Adderall is a mixed salt of dextro and levo. It's a 3-to-1 dextro to levo mix. Another random drug that metabolizes into another drug is macitentan. This is an endothelin receptor antagonist used for pulmonary arterial hypertension. It's metabolized or dealkylated into aprocitentan. This medication was just FDA approved last year for the treatment of resistant hypertension or high blood pressure that's not resolved with other agents. So let's say someone's maxed out on amlodipine and lisinopril and hydrochlorothiazide. This might be an appropriate option, albeit there are some other antihypertensive agents that we already use like beta blockers, clonidine, and hydralazine. These are the name brands if you're interested. Opsumit and Trivio. I thought this was interesting, but the most common side effect for aprocitentan was edema or fluid retention.